Hi, I'm Derry from Derry Brown Physio Fitness, and today we're going to talk about knee pain. Now, the information in this video isn't meant to replace assessment by a healthcare professional, but I'm hoping it will help everyone learn a little bit more about their knee and a common condition among the active community. So in this video, we're going to talk about patellofemoral joint pain, also known as runner's knee or anterior knee pain. We're going to talk a little bit about the anatomy of the knee, what patellofemoral joint pain is, and two common assessments that you can look at to see if they are causing your knee pain. Patellofemoral joint pain is one of the most common causes of exercise-induced knee pain, and it's more often than not atraumatic, which means there's no single injury or event that caused it. And so you're probably wondering, what is the patellofemoral joint? So it refers to the way that your kneecap glides in a groove on your thigh bone as you bend and straighten the knee. So as is often the case with physiotherapy, this is actually quite a broad term, but it's used to describe pain that we think is originating from this joint. It's normally caused by excessive repetitive loading, and often there's a biomechanical issue to do with the way that your knee moves when it's under load. Let's talk about the symptoms. So normally it's a gradual increase in pain that feels like it's behind the kneecap. There isn't usually swelling, and it's normally not that painful at rest. But as soon as you start loading that knee, you'll start to get the pain. So now I'm going to go through two common problems which can often cause this, how to assess them yourself, and then what you can do to try and improve it. So pain is most often brought on by loading on a bent knee, things like going upstairs and particularly downstairs, as well as walking or running any distance, and driving often will irritate it as well. Don't forget that everyone is different when it comes to things like range of movement and muscle strength, so the most important thing is that you compare the painful side and the not painful side. So the first thing we're going to talk about is weakness on the side of the hip. So if you're weak around the side of the hip, then when you load on that knee, sometimes the knee can come inwards, which then causes irritation of that patellofemoral joint. This might be evident on a single leg squat test, and again you can compare left and right and see how the knee moves, or you might find that on a normal squat one knee will come in with what we call knee cave. So what we want to do is look at the strength of those muscles on the side of the hip. So what you can do is lie on your side, keeping the feet facing forwards, and then lift that leg up and down in the air and see how many reps you can do before fatigue. Look for things like shaking to see if there's any particular weakness, and then again compare it to the other side and see how many repetitions you can do there. So if you identify that this weakness is an issue, then obviously we want to try and work on the strength. So you can strengthen it using that side lying exercise that we did for the assessment, and other things like a side plank, as I'm showing you here. And then realistically, when we're looking at trying to improve muscle strength, we're talking about a minimum of 10 to 12 weeks. So this is something that you've got to be consistent and patient with if you want to get those results. The other thing that commonly causes patellofemoral joint pain is issues with ankle mobility. So you can assess this by doing a knee to wall test. As I'm showing you in this video, mark out a point on the floor, place your toes at that point, and then try and get your knee to the wall in front. And again, you can compare left and right and see if it's easier or not to get one knee to the wall. So the reason that this is important is because our knees will need to pass our toes, particularly if we're doing things like squatting. So if you're restricted ankle mobility, then often your knee might need to move into an awkward angle to allow you to get down towards the floor. So you can work on ankle mobility by doing a stretch the same as that assessment to improve this and hopefully improve your squat. Okay, so just to recap, we've looked at strength on the side of the hip and ankle mobility as two common causes of patellofemoral joint pain. The other key with trying to improve patellofemoral joint pain is reducing that aggravating activity. So you might find that you need to reduce that load with things like squats or any kind of single leg work that particularly irritates it. You can use things like short courses of ibuprofen as well to help it settle, but I would do that combined with reducing that activity. Otherwise you'll find it'll just come straight back when you finish using the medication. Okay, so if you've got any questions or you're concerned about your knee pain, feel free to send me a message, or otherwise you could ask your GP to refer you to a physiotherapist for an assessment. Thanks for listening, and I hope everyone found the information helpful.